Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on vhha.com and on popular podcast hosting apps, including Apple Podcasts, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, the Virginia Audio Collective, and the World Podcast Network. Podcast episodes also air Sundays at noon on 100.5 FM, 92.7 FM, and 820 AM across Central Virginia, 1650 AM in Hampton Roads, 105.1 FM and 1050 AM in Lynchburg, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to ecfpodcast@vhha.com. Again, that's ecfpodcast@vhha.com. And today we're pleased to be joined by the Honorable Rodney Willett. He is a member of the Virginia House of Delegates who represents the Henrico County-based 58th District. Delegate Willett joins us for a conversation about his work and career, his role as chair of the Select Committee on Advancing Rural and Small Town Healthcare, and more. So with that, welcome to the show, Delegate Willett. Thank you for being with us.
Julian, it's great to be with you this morning.
Well, we really appreciate you making some time in your busy schedule for us, so we're just going to jump right in. We like to get these conversations started by getting to know our guests a little bit better. For the benefit of our listeners, you grew up in a family of teachers. You earned undergraduate and law degrees at the College of William & Mary. You're currently in your third term as a member of the Virginia House of Delegates, and you're a proud family man. Beyond those few surface details, what should people know about your unique personal story?
Well, I've been very fortunate, again, to live my whole life and my whole career in Virginia. And you mentioned my connection to Virginia, particularly through my education, my family's background in education. And one of my family members sort of sparked my interest in legislative affairs going back to when I was in high school in Richmond. So I've had an interest in the legislature for a long time. Had a longer career, first in law, then in technology. And most of that work was with state government. So that gave me a lot of exposure to Virginia agencies. And I knew a lot from the outside. I was fortunate to also work for companies that had a give back model, a lot of focus on supporting the social safety net, including healthcare related charities in the greater Richmond area. I thought that was going to be my thing, my purpose, and really just carry that out for my career. But what I realized to really move the needle, I needed to jump to the other side and actually get into government. And that's what led me in part to run for office going back 5 years ago.
And you mentioned being able to impact the process from the other side. And that's a great segue to our next question, which focuses on some of the areas that you focused on in policy during your time in the General Assembly. You've been instrumental in passing laws related to healthcare access, health workforce recruitment, early childhood educational opportunities, mental health programs, environmental protection, voting rights, prescription drug costs, and gun violence. If you would, tell us a little bit more about those areas of focus in public service and what really brought your microscope onto those particular topic or subject areas.
Yeah, a lot of people look particularly at my current legislative service and the bills I chair, but also the things that I'm chairing. For example, I chair the Joint Commission on Healthcare. I chair the Behavioral Health Commission committee under HHS in the House. I lead the Virginia Health, or chair the Virginia Health Workforce Development Authority board. And so some would say, well, you must have an extensive background in healthcare. And I think, as you heard, that's not my background, but I have a deep passion and deep interest in it, really from lived experience, from seeing, even my own family members who had difficulty accessing services, particularly in the mental health area. There are just challenges in Virginia, and I saw that from my own family. I saw that for friends, and then as I started thinking about running, I realized this was actually a statewide problem, that people were not able to get the services they need. And so that really was the inspiration for me to run, and has really guided a lot of what I've focused on in the legislature for the last 5 years.
And you talked about some of the legislative panels that you have the honor of leading or chairing. One of those is the House Select Committee on Advancing Rural and Small Town Healthcare, which was established earlier this year by House of Delegates Speaker Don Scott. The Select Committee is assessing the state of affairs in rural health and care delivery, and after much investigation and research and visits around the Commonwealth, the committee is now preparing to issue its final report. We were recording with Delegate Willett in December of 2024. If you would, sir, can you tell us more about the work of the committee and where things stand now?
Well, it's interesting because a lot of people say, why you, Rodney Willett, is the representative for Western Henrico County, which is anything but a rural part of Virginia. Why are you representing and leading the Speaker Select Committee? Well, I did actually grow up in a very rural area. Prince Edward County, Farmville, Virginia, was my hometown for my formative years, 13 years of my life. And it's interesting to look back on my time there because when I lived in Farmville, if we needed to go for a dental checkup or a pediatrician visit, we got in the car. And we drove to Richmond because that's where my mom was from. Her parents were still living there, and that's where we went to the doctor. When she got ready to have my youngest brother, I have three younger brothers, but when it was time for that delivery, we got in the car. We drove to Richmond, and we actually lived in Richmond with my grandparents for the better part of a week. I didn't think anything about that. I just thought that's what most people did. What I didn't realize is that most of my friends in Farmville didn't have that opportunity to be able to drive somewhere to get health care. And so that was my background, my story. And Speaker Don Scott, in looking at healthcare needs across Virginia, realized we have a particularly acute need in these rural areas. He asked me to chair the committee because of my interest in healthcare, also because of my Farmville upbringing and connection there. But really the impetus for it was what he had seen, particularly in Southwest Virginia, a trip he took out there at the invitation of Senator Travis Hackworth, hospitals in some areas that have closed, other areas where people just can't get to the services, even if there are facilities available. Sometimes the drive times are too long, or they just don't have a means of transportation. And so that led to the creation of this committee. It's a bipartisan committee in the House. We took, starting this past spring through this early fall, we traveled the state. We went to Southwest Virginia. We went to Southside Virginia. And finally, the Eastern Shore, to hear from healthcare providers, to tour health facilities, including a number of rural hospitals, FQHCs, free clinics. And we heard literally from hundreds of people to get their suggestions and put together a series of recommendations for the speaker.
And what were some of the more eye-opening things that you saw or heard or learned?
Some things we expected to see. For example, I do a lot of work in health workforce. As I mentioned, I chair the Virginia Health Workforce Development Authority. So from that work, I already was aware of really across the state of workforce shortages at all levels, not just physicians, but nurses, the whole spectrum of healthcare providers. What we saw when we traveled was that those needs are the same or worse in rural areas. In fact, oftentimes the problems are magnified because it's just even more difficult to recruit and retain healthcare professionals in a more rural setting. So that was not a shock to see those numbers, but then again, when you're on the ground hearing directly from folks who are trying to get providers into their area, you realize, this is a serious issue, and particularly where folks have been recruiting for some time, and they'll get someone into an area for a couple of years and then lose them. And I think that's what we realize, that it's hard to recruit when someone's not from that area. The other thing we saw, and this really was a surprise, is the magnitude of the transportation challenge. This was something you could sort of guess at it. That if you're in Southwest Virginia, it's a mountain area. Takes more time to get from A to B. But when we got there, without any coordination amongst the people we were meeting with, literally every single person we talked to at every healthcare facility, every free clinic, every presentation, we heard from providers, same message. We can't get people to our facilities. We can't get people to their follow-up appointments, and particularly in a maternal health setting where you need that critical prenatal postpartum care. We realized that a lot of moms were just not able to get to those appointments. So that was probably the most significant, the most eye-opening thing that we heard and learned.
Well, I appreciate you sharing those observations. For some added context for our listeners, The Weldon Cooper Center at UVA indicates that 11% of Virginia's population lives in rural communities. Virginia has several dozen hospitals across the Commonwealth that are designated as rural providers by federal definition, and there are many others that aren't necessarily designated as rural hospitals but still serve rural populations. And looking at the data, rural communities tend to have older populations experiencing elevated rates of chronic illness, often with higher rates of reliance on government programs such as Medicaid and Medicare. Delegate Willett, you mentioned hospital closures a few minutes ago. Across the country, nearly 200 rural hospitals have closed in the past 20 years due to financial and operational challenges. This fall, VHHA released the 2024 Virginia Rural Hospital Report, which highlights the challenges rural providers face and some innovative programs they're pursuing to enhance access to care. This report also offers a series of administrative and legislative proposals to help improve and sustain access to care in rural Virginia, focused on 5 policy areas, including some of the ones Delegate Willett mentioned. Those areas are behavioral health, maternal health, which Delegate Willett mentioned, healthcare workforce development, which you mentioned, telehealth, and transportation, which you mentioned. We'd certainly recommend that anybody who wants to learn more about rural care to visit our website, vhha.com, to see that report. I know you've seen the report, Delegate Willett. Considering that document as well as the work of the Select Committee, can you give us a little bit of a look ahead about some of the kinds of rural health policy initiatives that might be on the docket for the 2025 Virginia General Assembly session?
Well, Julian, I first want to say thank you to the VHHA for doing that report. It was just a great parallel effort to our work with the Select Committee. And what I found, this is interesting, is that we really ended up in most of the same places in terms of the issues that we identified, that we see in the VHA report, and then what we're going to see in the report we issue to the speaker. One of the initiatives you mentioned that's highlighted in the VHHA report is telehealth, and we certainly heard loud and clear that telehealth, particularly post-pandemic, during the pandemic and now post-pandemic, has played just a critical role really across Virginia in getting people access to providers where it's just not always practical to be there in person. I had a personal experience with that during COVID, where my own father had a series of health issues, and he was not completely immobile, but certainly was not in a position to be going to dozens of doctor's appointments in person all the time. And so we were able to leverage telehealth multiple times for him, and it really made all the difference in the world. It's not a complete replacement for healthcare, but as a supplement, it was just invaluable to my family. So what we heard, again, from folks in all parts of rural parts of Virginia, is that telehealth really is part of the solution. It's just not practical, going back to the transportation issues, to get people in doctor's offices every time, particularly on these follow-up visits where it's not like it's not a procedure. It's maybe a follow-up from a procedure, from a surgery, from some other medical service. And a lot of it is just a touch base with the provider. And that can be done by telehealth. And we've made great progress there with our telehealth network. We need to expand on that. And what's great is to see the VHHA report recommendations on telehealth, including mental telehealth, which is really, again, during COVID was leveraged. We're doing it more now. And we've seen VHHA recommendations, and now you will see Select Committee recommendations that are going to try to expand on that and really make it available. Here's an example for young people. I ran on a platform of several items, including really focusing on the mental health of children and teens who just really struggling. We've seen the numbers jump up so much in the area, and a lot of these kids need access to mental health services and their follow-up counseling during the school day. And it's just not always practical to get them to an appointment, or not even possible to get them to an appointment in person, but they can do follow-up in this private area in a school via telehealth. And we're looking at legislation to ask the Department of Education to make that a requirement of schools across the Commonwealth to enable that type of service.
Yeah, and as you point out, certainly during the pandemic, there were added flexibilities that were implemented by governmental agencies to allow for telehealth services and for reimbursement of telehealth services that in some cases had not been previously permitted. And so, as you point out, there has been a growth in the availability of telehealth services, whether in rural settings or in suburban or urban settings. And so as a means to connect with people who may have access issues, transportation issues, distance issues, geography issues, that certainly is an important tool to make sure that people can get access to care, as you point out, particularly for some of those follow-up appointments and check-ins. Delegate Willett, we are just about to close things out, but before we do have a tradition here on the podcast to bring things full circle and end where we started, which is learning a little bit more about you. And so to do that, we have a list of 10 mystery questions. If you would, please pick two numbers between 1 and 10, and then I will ask you the corresponding questions.
Let's do 2 and 7.
Okay, 2. If you were stranded on a deserted island, what one book, one album, and one movie would you take with you to keep yourself company? We will spot you a copy of the religious text of your choice. So other than that, what are your 3 entertainment survival kit picks?
Man, well, I'll tell you, I just finished reading Barbara Kingsolver's Demon Copperhead, which, if listeners don't know, that's the book actually set in Southwest Virginia. And among other things, there are major health care challenges that are addressed in that book. So I read that book, over the course of time as I was working on finishing this final report. So I felt like I was actually living part of that story. But it's an amazing, if folks haven't read it, I can highly recommend it. I think Barbara Kingsolver just got a Lifetime Achievement Award from that National Book Award folks. But it's quite a portrait of Southwest Virginia, and it's tough love. It's tough love in terms of what has happened there. It's a fictional account, but a very real story that so many people are living in terms of opioid addiction and healthcare access and other issues like that in the state. So that really came home to me in terms of reading that. In terms of music, gosh, where to start? I could take any particular album. I actually have a real passion for, among other music, bluegrass. And so give me some good bluegrass music from even the old stuff, going back to like Ralph Stanley, speaking of Southwest Virginia.
I am a man of constant sorrow. I've seen trouble all my days.
I was just out on the Crooked Road. We had a appropriations retreat in Abington. Got to tour in Bristol, the amazing country music museum there, but really getting back to the roots of this great music in Virginia. So yeah, anything from that era and our founding fathers and founding mothers of that music, it really would inspire me. And you asked me for one more thing. You said album, and you said
Movie is the
book.
one.
Wow. I don't see as many movies as I would want to, but there's some I certainly have been, inspired by, and I'm trying to think of which, what would be most, if I could only narrow it down to one. I do like, the biopics that are really well done. Like, you remember Lincoln was filmed partially in Richmond. Daniel Day-Lewis, I'm just such a fan of his. And to think, I did not actually get to see him when he was in Richmond for the filming. I have friends who did. And he stays in character the whole time. So like when he went to lunch a couple places like up in Churchill, he's still President Lincoln during that time. And so, but to see him getting to character and then to really, I think through him, better understand that most amazing person, Abraham Lincoln, and what he was going through, particularly in grappling with, nation at war with itself, I should say, and all the challenges that came with that, the abolition of slavery, trying to hold this whole thing together. And to see one actor like that be able to capture really the turmoil that the president was going through, I could watch that movie a dozen times.
We're stepped out upon the world stage now, with the fate of human dignity in our hands. Blood's been spilt to afford us this moment, now. See what is before you. See the here and now. That's the hardest thing, the only thing that accounts. Abolishing slavery by constitutional provision settles the fate for all coming time. not only of the millions now in bondage, but of unborn millions to come.
Well, some good recommendations there. And I do remember being around the Capitol when Lincoln was being filmed, when they had done some of the superficial work to make it look like the Washington Capitol of yore. And that is a very good movie, so appreciate those picks. Yeah. And then you also selected number 7, and that question is, if you could choose one superpower to have or any one skill to instantly master, what would it be and why?
I do pride myself on being a good listener, and then my wife tells me I'm a terrible listener. So I think I really do try to listen, but I think particularly in the job I am in, and given, for example, that we've been talking for most of this piece on the role select committee's work, and I think of all the constituent interactions I have, and I think it's so easy because you can say I've heard it all before, and so yes, I will nod appropriately, but am I really taking in what this person is saying? And what I learned, but again, particularly from our most recent travels around the state, is you have an idea, you think you know what's going on, and so you're going to maybe give lip service to that, let people say their piece, but are you really hearing what they're saying? And I think if I could have a superpower to be the best possible listener and really understand every word that people are sharing, because we did learn. I mean, it's said to us several times, and then I think we as a committee absorbed what we were hearing around the state of these dire needs in the rural healthcare area. And so I think I'm going to take that as a lesson and going forward. You can have your preconceived notions and whatnot. That's fine. That's maybe some background you have, but to really listen and understand folks everywhere, I think is so important.
That is great advice. As they say, we have 2 ears and 1 mouth for a reason. So appreciate that perspective. And with that, Delegate Willett, that's going to bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so you know when new episodes are available. And we want to once again thank our guest, the Honorable Rodney Willett, a delegate in the Virginia General Assembly who represents the 58th District in Henrico County. So thank you, sir.
It's been a pleasure. Thank you so much.